Hello friends, welcome to Creative Medicine. In this lecture, we will learn about 50-year-old man presents with 3-year history of irritability, low mood, lack of interest in the surroundings and general dissatisfaction with everything. There is no disruption in sleep and appetite. He has been suffering from. So here there is 3-year history. Okay, there is irritability, low mood and lack of interest, and there is general dissatisfaction of everything but normal sleep and appetite. Always remember, if there is long term less severe symptoms of depression, for long term it is actually a case of dysthymia, because here the depression is for 3 years and it is not severe, it is mild. So this is a case of dysthymia. Thank you, and thank you for watching.